Okay, thank you for the introduction and welcome to my presentation on our first dark field CT and how we realized this by implementing a Talbot-Lau Interferometer into a clinical CT gantry. So as a brief introduction, I brought here some results from a clinical radiography system. And there we see that in these two examinations of a healthy and a severe COPD case, that in the attenuation channel, we can hardly differentiate these two cases. They look the same. But whereas in the dark field channel, we can easily separate these two cases because there we are sensitive to the small angle scattering of the radiation in the healthy lung tissue, which is very porous. And if a lung disease, like for example, COPD or COVID, now degrades this porous structure, we measure a reduction of this signal, and yeah, we can see this here. Our objective is now to bring this imaging modality to clinical CT and make it a quantitative imaging solution. And for this, yeah, we need a specialized imaging setup. And in our implementation, we here focus on a so-called Talbot-Lau Interferometer, which consists of a set of 3 gratings in the beam path. This produces a fine interference pattern in front of the detector, which well, is attenuated or reduced in intensity by the attenuation of the sample. So pretty straightforward what happens in a regular CT as well. But now with its setup, we are also able to resolve the small angle scattering, which reduces this visibility of the pattern. And yeah, so we get this novel data information from the images. For the problem is that this interference pattern is in the micrometer range, and so we can't resolve it with the detector directly. And to solve this problem, we need this last grating, the so-called analyzer grating, which converts this fine interference pattern to resolvable moire fringes. For implementation of such a 3 grating interferometer into a clinical CT gantry, there are several challenges coming up, and I just listed here some of them. So we have to somehow put these 3 gratings into a CT gantry where the space is really limited, and generally these grating interferometers profit from a long propagation distance. So this is the first problem which comes up. Another problem is that these structures are very fine, and so already smallest displacements can lead to a total loss of imaging performance, and which, yeah, this makes the setup extremely sensitive to vibrations. And then, of course, in the clinical CT gantry, we have this continuous rotation, and we need a new data processing and reconstruction approach for this, since, yeah, this is not the standard mode, acquisition mode, which is used in laboratory setups. On this last point, we brought 2 posters to the conference. You can visit them tomorrow as poster 10 and 15. And in my talk today, I'll cover yeah, now the first 2 points in more detail. And I'll start with the solution for how to implement these 3 gratings into the just 90 centimeters of beam path in a clinical gantry. And the first step is, yeah, to maximize the use of the available spaces, to position the first grating, this G0 grating, as close to the source, and yeah, the last grating as close to the detector, which is pretty straightforward. But then the remaining grating, this G1 grating, can either go in front of the patient or behind the patient. And there we found that positioning it in front of the patient on the source side gives us several advantages. Yeah, so this geometry is then called the inverse interferometer geometry. In this geometry, the first 2 gratings have the finest gratings periods. This is generally difficult to fabricate because the periods are so fine, but fortunately, these 2 gratings are rather small in total area because they're so early in the beam path. So this fabrication is actually feasible. And another positive aspect is that we were able to develop this very compact and rigid implementation for this for first 2 gratings, which is important because for these fine grating periods, if these gratings are not rigidly mounted, otherwise, yeah, stability issues can arise. And so this way we were able to solve this problem already very early in the design process. And then on the other side of the gantry, this large analyzer grating has to be implemented. It has to be 80 centimeters wide, which makes it currently probably the largest grating of its kind. And we have to implement it from 13 individual tiles. So you see it here. It's stitched together to make this 80 centimeters length. Fortunately, the grating period of this analyzer grating is really large or very coarse compared to the first two gratings. So this fabrication and this implementation both was rather easy. And yeah, for explanation, the first image here, perhaps it's not visible for everybody. On this surface here, there's the G0 grating. On the opposite side of this structure, there's the G1 grating mounted. Okay, so with this geometry now in place, we need a set of gratings which performs well in this very short design. And there we found in wave optical simulations that particularly a careful choice of this G1 grating is important to have a good performance despite this short propagation distance. And the solution here is to have a triangular grating profile for this G1 grating, because this can efficiently shorten the required propagation distance in the system. And we can show this here in the Talbot carpet simulation behind such a triangular G1 grating structure. And there we see that already after very short propagation distance, a very intense interference pattern occurs. And by positioning this analyzer grating right at this position in the Talbot carpet, we can make use of this high intensity interference pattern and achieve a good performance in the setup. Okay, so with this inverse geometry and this triangular G1 grating, we then optimized the remaining design parameters of our setup and came up with this table here, on which basis we then implemented this prototype system. For today, the most interesting in numbers are probably this G0 grating, which has the highest aspect ratio, so the most difficult grating to be fabricated. And there we see that it has a grating period of 4.8 micrometers, but a grating height, so the structure height of these gratings is over 200 micrometers high. But here it's important to mention that all these gratings we use here are within the range of current state-of-the-art grating fabrication technology, and so they are even commercially available. And yeah, so with this setup now in place, let's look at the implementation of the system. And we implemented this into a Philips Brilliance ICT gantry. And our objective was here to keep the modifications to the system as small as possible. And there we achieved this by implementing the first two gratings directly into the collimator box. And so basically this compact assembly of the first two gratings goes in there and replaces one of the bow tie filters, which is a pretty straightforward, elegant solution. And on the other side of the gantry, we had to change a bit more. So we removed this high resolution comp, this ultra high resolution comp, which usually sits there. It's an optional component anyway, and we don't need it for chest CT. And then implemented this large analyzer grating in front of the anti-scatter grid of the detector. So we keep this also in place. And in our prototype, this implementation of the analyzer grating is actually done by assembling it tile by tile into the gantry, which is kind of a pain to do it, but we got really good at this and works pretty fine. And then, yeah, it covers this way 90% of the original field of view. And yeah, and we were able to maintain, do not change anything to the housing of the detector, which was very important at this point. And of course, then we are not able to move it in and out again, but it's a prototype system, so this is okay as well. And yeah, that's pretty much it. So the implementation is rather straightforward, but now clearly the question comes up, yeah, how stable is it during rotation? And for this purpose, I brought here some raw data output from a sample-free tomography scan. And there we see that the moire pattern, the moire fringe pattern of the system is not actually stable as it should be, but we see that it oscillates a bit. But here it's important to analyze this movement, and we see that that we have two dominant oscillations in the system, which are high frequency oscillation caused by the rotation of the X-ray tube anode, and a much slower one, which is caused by the deformation of the gantry during the rotation. And fortunately, both of these frequencies can easily be resolved with this high detector frame rate, and we can, yeah, process them or include them in our data processing and even take advantage of these oscillations, as you will see on our posters tomorrow. So now let's talk about the performance of this interferometer, because this is really important for the dark field imaging process then afterwards. And this is quantified or characterized by the contrast of this moire pattern, so the visibility of this pattern. And there we find that in our implementation, we have a mean of 22% visibility in the central half of the interferometer. So in this region here, and there in this very center, there are peaks of even above 26% visibility. This is very close to our expectations from simulation results. So this is a good result for such a compact and, yeah, rough environment. But we clearly see to the left and right that the visibility degrades somehow. And there, the visibility does not go to 0 as it's indicated here. It always looks a bit strange on these projectors. No, it goes to like 10% in these outer regions. And this is still sufficient for our tomographic reconstruction, where we can easily compensate for this gradient in the visibility. And I brought for this purpose here to a reconstruction of a Langman phantom, which is basically the chest of a human. And there we see that with a 45 centimeters field of view, we now can reconstruct a really large area in both these imaging channels, the attenuation channel, basically as at a normal standard CT, and now also in this dark field channel, where we now resolve scattering properties inside the sample, which are well below the resolution limit of the CT. And there we see that, yeah, some scattering is happening inside this this chest phantom. This processing is done coming from one axial rotation, so just one rotation is included in this data, and our processing does this in like 2 to 3 minutes. More results on the tomography and yeah, better discussion of these results will be given by my colleague in the second talk afterwards now. And he'll walk you through these results, and he will also present our first results with biological material, which was a very recent milestone for our project. For now, that's pretty much it from my side. I want to summarize somehow. We have now reached yeah, dark field imaging in clinical scale by realizing this in a clinical gantry. We found an efficient and very compact implementation of such an interferometer, and found that there are two key aspects which may make this possible. The inverse Talbot-Lau interferometer geometry and this triangular grating structure. And demonstrated this in a brilliant ICT gantry from Philips, and which we upgraded basically to do a dark field imaging. And yeah, we have only found a minor impact of these vibrations, which is really cool. And the 22% visibility with this large field of view of 45 centimeters and 2 to 3 minutes reconstruction time of the specifications of the system. Yeah, so with this, I'm now through my presentation. I want to thank our partners for the support to realize this large project, and thank you for your attention.
Thank you. This paper is open to questions. Please use a microphone. So, hi, good morning. Thanks for the nice presentation. I'm not very familiar with the dark field imaging, so my question might be a little naive. But as you can see on the slide here below, you can see the different parts of the grating. You said that analyzer grating was divided in 13 pieces, but you can clearly see the different pieces and the seams in between. Does this cause artifacts, or is this not a problem at all?
These are basically dead pixels, which we can interpolate and reconstruct without artifacts. So this works pretty fine. Yeah.
Okay, that's it. Please.
Thanks for the nice presentation. You didn't explain why the visibility is lower at the edges of the detector. So.
Oh yes, yeah. I probably skipped this. It's too easy problems arising there. We have shadowing in these grating structures, high aspect grating structures, and in these outer regions for these larger fan angles, we have an extremely large source spot, and so there the shadowing increases.
Oh, I see. You mean the shadowing due to the increased size of the focal spot?
Yes. So on the 0 degree projection for the 0 degree angle fan angle, it's a square focal spot, and 25
because
degrees,
all the gratings are basically cylindrical, right? So
yeah,
they are all focused to the X-ray focus.
They are bent to the focal spot. Yes.
Can you maybe also comment on the quality of the conventional attenuation images, because there's a dose reduction or loss in dose due to your G2 grating?
Yes. So on the dose in the following presentation, there will be some information on this. But for now, this we are measuring with 80 kV. And so we have a pretty low dose compared to other CT measurements with 120 kV. But of course, yeah, we lose like 50% behind the patient, which is a problem somehow, but we can compensate for it by the reconstruction of 2 image channels. And the absorption images look just as from a regular CT. Resolution-wise, of course, we're here not using a focal spot jump yet, so the resolution is still a bit smaller.
Thank you.
I have several questions about the technical aspect. You said it's operated at 80 kV. How about the 120 kV performance? What visibility did you get? Like, for example, majority of the CT was performed at that higher kV. And second is, how do you do the phase retrieval?
So for the first question, these gratings are optimized for 80 kV, which is particularly important for this triangular grating, which performs best for 80 kV. If we go now for higher energies, we by design get a lower visibility. It's not like going down to 0, but it degrades. With another triangular grating as a G1, we would get better visibilities there, but there this stopping power of the gold gratings would be smaller. So at the moment, 80 kV is the going to value. And then the phase retrieval is done with a sliding window approach, which will be on our posters tomorrow in more detail. And yeah, this is the approach currently with a sliding window approach.
Thank you.
Yeah, thank you for the nice talk. I have a simple question. What is the image model you're talking about here using? Namely from the data to image or going through the reconstruction of the data. So what is the model you're using?
So I'll be
very naive question.
I did. So
Yeah.
we do the phase retrieval on the projections and then reconstruct with filtered back projection at the moment.
So you assume it's a line integral.
Yes, yes.
Okay,
yeah,
thank
yeah,
you.
So sorry, yeah. So
All right.
that's the point.
Right. If no more questions, I thank our speaker again.